Yeah.
There we go. All right. Sorry about that. I think I got like a call in the middle and it kicked me out of the live. I'm sorry about that. Perfect. Sounds good. I think we're ready to go.
Good evening everyone and good morning to the other part of the world. I am Dr Arika Bansal from Eugenix Hair Sciences. I invite Melvin from Hair Restoration Network and Dr Pradeep from Eugenix Hair Sciences to join the live now. And we look forward to the audience, the questions that they ask us in between. We like to answer all those.
Hey, Dr. Arika.
Yeah, hi Melvin, welcome.
Hi. All right, so I guess we're just gonna wait for Dr. Sethi to join,
Yes.
right? How's everything in Mumbai?
I'm in Delhi actually.
Oh, you're in Delhi.
Joining from Mumbai. Yeah.
Got some good people joining. It's gonna be really good. We're gonna be asking. I'm gonna be doing like a live consultation with Eugenix, so I'm gonna be asking all the questions that anyone who's interested in having a hair transplant would ask a prospective clinic. You know, about medication, you know, how many grafts you can get, the experience of the team, you know, who's going to be doing the surgery, even, you know, COVID protocols and everything. So it's going to be very informative. So you guys stay tuned. I guess we could get started, me and you, Dr. Arika, just
yes,
while he joins us. So
yeah, by the time he joins us, we are ready to go.
Yeah. So I guess my first question, and I think one of the most important questions that someone who's going to have a hair transplant should be, who's going to be performing the surgery? What aspects of the surgery will the technicians be doing versus what the surgeons will be doing? So for anybody here watching, I'm going to be going to Eugenix late December, early January, and I'm going to be getting my crown done, which will show you guys, you know, my crown hair loss. And so I want to be asking, you know, Eugenix, you know, who's going to be performing what on the day of the surgery?
So exactly. So before I embark upon the actual surgical steps, let me just go a bit earlier to that phase before starting the surgery. In spite of the consultations, the video conferences, etc. that we have prior to the day of surgery, it's very important for the patient as well as the doctor, the operating doctor, to be on the same page. So on the day of the surgery, even if we have done a live consultation earlier, it's better to do the consultation and reiterate all the points again. So on the day of surgery, we take the pictures from all the angles. We mark out the areas which we plan to operate in on that particular day. For example, in your case, we'll be marking out the crown zone. So when we mark out the crown zone, we can mark out both the maximalistic approach and the minimalistic approach. And we discuss all the options with respect to the amount of coverage that you are looking at. It is very important for the doctor to have an idea of the degree of your aspirations. What are your priorities? Based upon your priorities, whether your donor, whether it's the scalp or the beard, is enough to satisfy the need. So that is very important. And it's better to show the marked pictures on a big screen from all the angles so that there is no room of any confusion left. So once this surgery and the planning designing, the initial pre-surgical phase is over, we actually trim the area, the recipient zone and the donor zone which we are going to extract from. And then we do a antiseptic shampoo which takes 5-10 minutes, and then we take you inside the OT. Now inside the OT, the steps which have to be done by the doctor only are administration of local anesthesia, administration of intraoperative PRP, which we usually do at the time of before making the recipient sites or immediately after making the recipient sites. So giving the local anesthesia, administering the PRP, intraoperative PRP, making the recipient sites, 100% recipient sites, then administering the local anesthesia in the donor zone, then extraction of the grafts. Now extraction involves 2 steps. One is the punching, when we use a punch, whether it's a sharp punch or a trumpet punch or a blunt punch, for actually dissecting the hair follicle from the surrounding tissue. That is the first step. Then that punch graft is picked up by the technician. Okay, so the steps which are done by the operating physician are administration of local anesthesia, the PRP, making of the recipient sites, and in the extraction part, we first punch the graft recipient site with the punch, and then the punched graft is picked up by the technician. Now that technician is supposed to record whether it's a single, double, triple, or a partial transaction or a full transaction. That the recording is done, and then that graft, extracted graft, is loaded into an implanter, and then that implanter is unloaded into the pre-made recipient site by the technician. So the steps which are done by the doctor are making the hairline design, administering local anesthesia, making the recipient sites, and extracting the grafts. Now at Eugenix, when it comes to extracting the grafts, the crucial part of the extraction, which is actually the initial phase where we determine the size of the punch, the type of the punch, the depth that will be used is sometimes done by the founding surgeon, and the remaining steps of extraction are done by the assisting physicians and the assisting technicians. And the rest of the steps, which is counting the grafts as singles, doubles, triples, or quadruples, noting down the full transaction, partial transactions, loading the grafts into the implanters, and unloading the implanter into the recipient site. Those steps are done by the technicians. So the actual step of implantation, which is the unloading of the graft into the recipient site, is being done by the surgical assistants.
So, Dr. Sethi, so when I was on, you hadn't joined yet, I asked Dr. Arika who will be performing what steps during the surgery. She, just to give a quick summary, she said that first we'll do the consultation, and we'll talk about my goals, what I expect out of surgery. We'll have my hair loss pictures on the screen, which if you want to share with the audience right here what the pictures I sent, you guys will have them on the screen. You guys will mark out the areas. You guys will shampoo me and then take me to the OR. You guys will then perform the local anesthetic, the PRP, and then she was talking about the extraction process, about the different types of punches. And just, you might want to move the camera just a little bit there, Dr. Sethi, just to kind of show the audience what my crown looks like. So that's the front. That is that's top down. That's the side. So there you go. There's my crown. So it's quite a large area. Doesn't have that much hair in there. So it's gonna be a big, not a huge surgery, but a pretty moderate sized procedure. So she was talking about the extractions, the different types of punches, and then that's when I came in, Dr. Arika, when you were discussing, the different types of punches. And I think you were talking about how the surgeon can score the graft, right? Puncture the skin, but then it could be the technicians that actually remove the graft from the scored skin. So the thing that matters the most, right, is knowing the depth and the angle when you puncture the skin. That is something that should be done right by the surgeon or by a doctor, correct? Not by the technician. Did I understand that correctly?
Yes, but at Eugenix, the crucial part of extraction is done either by me or Dr. Sethi, the initial part, but the rest of the extraction is being done by the assisting doctors also.
Assisting doctors, but it's all doctors doing the punching, is right?
Yes, true. So Melvin,
okay.
A very important point like that you have highlighted is the main thing, that is the designing part, like making the slits right angle, right direction, right depth, and calculation and the plan of the future. So that has to be done by the main brain, the main architect. So that's the doctor, and that's what we do at Eugenix. And and in our technique where we make pre-made slits, so that the fate of the surgery has been decided, and the rest of the procedure, like the unloading part, once the graft has been scored and that has been collected by the assistants, and then loaded into the implanters. You must have seen our procedure or the videos. We have implanters. The graft is loaded into that metallic structure, and the pre-made slits are there. So this loaded implanters, they go there and unload and come back. Just go like so. That does not need much skill, though every step has some requirement of skill. But this, in compared to the main work, that is the designing, the architectural thing, that's what should be controlled by the main physician, main doctor for which the patient comes. And I'm sure the most of the great doctors in the world, that is the most, we in medicine we call rate defining step. So that rate defining step is done by the doctors, and of course that is a huge time consuming procedure. Each graft has to be plugged and kind of rightly placed. So when you do many thousands of cases, many people are required. So which step to be done or delegated to people has to be kind of smartly done, so that the outcome, the ultimate outcome is not altered. And the ultimate outcome of that's what I quote from the poem, one of the paragraphs, how to choose a doctor. There, the initial few lines, he says that being patients, it is very important that we choose our doctors wisely, our doctor wisely, because the doctor you choose, that define whether how natural, how long lasting, how dense your results will be forever, for a long time. That means patients want a natural hairline, or natural looking hair, impeccable. Nobody should be able to make out that procedure done. Then second thing is, it should be dense enough that the scalp is not visible, and cover. Everybody who is in grade 7 or grade 6, they all want the scalp to be covered.
Yeah.
They have that desire, and of course they all want that the hair should last for a very long period of time, though we cannot guarantee how long they are going to stay. Sometimes the baldness affects the backside as well. So all those things are important. The doctor, main doctor, the architect who is answerable to all those things, should be controlling the whole procedure, and he's the ringmaster.
Right.
Everybody, all the assistant, nurses, technicians, he is extension of his body parts.
He's the captain of the ship.
True.
Pretty much. So he's captaining the ship, but he still has, people assisting. And I think it's also important to understand, and me as a patient, I understand that if you're getting thousands of grafts, it is virtually impossible for one person to do that all within one day and do it without fatigue, do it properly. So you need a team. You need to surround yourself around a good team of people that you trust, that you can delegate certain parts of the procedure to the team while you focus on the most important things. Which leads me into my second question, which was, what is the experience of the Eugenix team, of the other junior doctors, the technicians, and things like that?
I will answer that, Melvin. It is very, very important that the team in our Eugenix, Dr. Arika is sitting in Mumbai. So we started building the team in 2009. So by mid 2009 we started building the team. I went to a lot of doctors in India to see how they are working. And Dr. Arika went to a lot of he went to USA, went to UK to see a lot of doctors how they've gathered information from all of the world. And we started building a team. We practiced on goat skin, pig skin, cadaver skin for like 6 to 8 months. Then after that, we started doing the procedure. So those people, the initial, the group that we started together, out of that, most of the people, we started with 5, and out of the 3 of them, they stayed with us for close to till 2020. And out of that, the main 2 guys, they're still they're with us. So they know the body language, they know everything. So after that, in 2010, we have decided that we'll be doing only hair. So we relinquished our flourishing, cosmetic practice. We do only hair transplant, hair restoration, nothing else. So all our team that added on after 2009, 10 and all, so they have been with us for last 10, 11 years. And the most latest technician who is allowed to enter the theater or assist us is more than 5 years old with us. That means more than 80% of people that are working with us are with us since last more than 8 years. And
wow.
Anybody who comes to Eugenix, he says that this is so seamless, this is so synchronized, because we
Yeah.
drink, eat only that. Even last week when Carl from Dublin, he had come, he said, "Doctor, the same team." Like he came after 1.5 years, he said, "The same team." And yes, with each procedure, we all are improving, we become more refined. It is, as I said that it is very important that the captain of the ship should be very, very, skillful and should be intelligent, experienced, passionate. However, at the same time, the assistants should also be kind of, they should be kind of in the similar directions. And
Mm.
the skill sets, whether they're loading the grafts or just giving the insulin syringe or the giving or spraying or offering the tea to the patient, they all, that is art. They all improve with each procedure. And for that reason, when you see our results, every result becomes a magical kind of thing, because it is a contribution of the skills of all the people who are involved, including the nurse, including the person who, as I said, who take the blood pressure. So it is the whole team. If one of them is not there, probably will not be able to produce 100% that we have been producing. So the whole team, as I said, just to summarize, the main people who are closely associated with the person and the patient, they are with us for more than 7-8 years, and with many thousands of procedures they have done with us. And so we are like, I think now clearly I can say that the team is very, very important. Only I have got a lot of intelligence. Dr. Arika is more intelligent than me, but if the team is not there, and if you would have been given a new team, probably we will not able to produce the magic that we have been producing.
Yeah. Yeah, and I think you talked about something that's very important too, and this is something that I looked into when choosing you guys, is that you guys specifically focus on hair. And what you'll see is that sometimes you'll see dermatologists or cosmetic surgeons that also do hair. So there's a difference between a clinic that really focuses on just doing hair and specializes in just hair, as opposed to someone who does, maybe they do lips and they do, eyes and breasts and all these different cosmetic procedures, and they also do hair sometimes. So that's for me, that was huge, because you guys are doing hair, all the time. Every procedure is hair, hair, hair. Your team is accustomed to doing hair, so you really have that, like you said, the synchronization, where you guys are just, what you're doing, because you've mastered it all the time. You're doing it all the time. So that's super important for anyone who's looking to get surgery. You should focus and get surgery from a surgeon that focuses on hair. That would be my advice, and that's why one of the reasons why I chose you guys.
So,
and
Ryan is saying that Dr. Arika has the best background. Yeah, she is sitting, in the Delhi office. I'm in my Mumbai office. Yes, Ryan, she has the best background amongst three of us. I'll tell you a very, very witty story. Like in 2012, when I said to Dr. Arika that then I'm going to focus only on hair. I cannot see skin patients anymore. She was upset. She was saying, like, a lot of doctors all over the world, they do great work, as well as and they do everything. So, and by the time we had a lot of good practice in dermatology in the small town in Dehradun. So, but our spiritual teacher Paramahansa Yogananda ji, he says that you should do small things in extraordinary ways, and you should do the best in your work and give your best, and dig the well at one point. Don't dig the well at multiple points, otherwise you will not get water. So that those things were there in my mind, and of course I started enjoying when something grows in something I have never done. So it is the challenge was art. No two faces are not similar. That means you have to customize. Like, if you see three of us in the frame, we all have eyebrows, nose, and all, lips and all, but the faces are different. That means it is such a beautiful art created by God. It has to be customized. And position of the hairline, position of the hair, position of the, some people have cowlick, some people have some deviation, some people don't have. You have to, that means one lifetime is not enough to master the artistry of the hairline and, position of the hair. Because every person's skin is different, hair quality is different, challenges are different. Like in your case, you have got already 3 procedures done. Your donor, I don't know whether you have seen that or not, like it is not the best of the donor at this point of time. but fortunately your beard has not been utilized yet, and your beard is a good beard. So
Mm.
like your challenge is different, but your
Mm.
challenge is to fill the crown. And of course I can see that if you get a little bit of temple done, then you look very,
Yeah.
you look very. I was talking to Amen in the morning today from Boston. He was saying that, like, I'm sure your doctor you're going to, once the canvas is in your hand, you're definitely going to touch on the hairline of Melvin as well as lose a little bit of temple. So
Yeah.
I think going to say is the challenges are different. You have to customize for every person, and you have to do the art. And so that for that reason, you have to do only one work. If you are doing multiple things, your attention, your skill, your talent is divided. Then you become mediocre. And we never wanted to be mediocre. And by the time the curtain falls on a career, people should remember us that we have done some good work, and we should live beyond our life on the heads of some people.
Yeah. No, I mean, I think that's great. And I did want to ask one question, because I think this is something that, especially coming from the U.S., and I'm sure, other people coming from Canada and Europe and different parts of the world, they're interested in knowing, what is the protocol for the whole COVID thing, the pandemic and everything. What do you guys do? What's your protocol for that?
Yeah, Dr. Arika, can you go ahead with this?
So for COVID, what we have done initially, we used to do the RT-PCR test for everyone who was opting for the surgery, and usually we used to do 2 RT-PCR tests, and at a gap of 3 days and sometimes 7 days, we used to scan the patient for all the symptoms if they have had any kind of symptoms. And when the vaccination was launched, so all our staff and doctors have been doubly vaccinated.
Mm.
And we keep on doing the RT-PCR test whenever we have to travel, and every patient has to mandatorily go for a COVID negative test. Luckily, till now, since the start of pandemic, there has been no complication occurring due to the COVID before surgery, during surgery, or after surgery. Luckily, and some people, they did get the positive results, and then they rescheduled the surgeries. Inside the clinic, we are doing double mask wearing for everyone, for all the technicians and doctors, the staff. The patients are also discouraged to come for more and more face-to-face consultations. We have switched on to the video consultations a lot.
Mm.
We do sanitization of the OT floor separately, and there is a separate floor for meeting and consulting the patients. So the outdoor OPDs on a different floor, and the operation theaters are run on a different floor. We have discouraged the practice of patient coming with a lot of relatives on the day of surgery. Social distancing is being practiced. Then we have put some purifiers which are very effective in making actually ICU kind of atmosphere inside the OT. Those purifiers we have put in. And post surgery, we do tell people to do a good quarantine if possible, as much as possible, social distancing and home quarantine post surgery. And I think it's going well. In fact, post this pandemic started, most of the people wanted to use this time of work from home
Mm.
to use this surgery, to use this particular time for surgery. So that's why we had a surge in demand. But
Mm.
initially, because we were very scared, we were doing just very less number of procedures every day. But gradually, now things are back to normal, I would say. But initially, yes, we all were very skeptical. When the second wave in India started, so that time again, the procedures didn't stop, because many people had scheduled their procedures quite much in advance. So some people were still doing the surgeries during that period of time. But yes, during that period of time, the number of cases had gone down, the number of surgeries that we were doing. But more or less, we have done well in spite of the pandemic. And yes, because of travel restrictions, many people are not able to travel. That's also one issue.
Yeah.
So this
But
is
I
what
think
I
it's getting better. Specifically here in the U.S., it's improved a lot. Things have gotten a little bit more normal. So I think another thing is that I'm going in December, and I believe in India December is the hot months, right? December, January, those are the That's the summer, no? Is it
No, no,
winter?
No, they
December
are going
is
to be winters. We are
Oh,
going to have winters in December. Yeah.
so
oh,
India,
okay.
Melvin, like the temperature in Delhi will be little bit lower. Mumbai will be very pleasant in December.
Mm.
Mumbai is like lower than Delhi in terms of like if you see the latitude. And if
Mm.
you go down south towards Kerala, it will be very very kind of very pleasant. So
Mm.
and nowadays the temperature they're not dipping that much. So December is okay. Yeah, yeah.
Okay.
December is okay. And there was a guy who looked you asked like a question like when you can do SMP after when you can do transplant after SMP. After 1 week of SMP, you can clearly do a hair transplant. And please, Mr. Luki, please go through one of our YouTube videos where we have we have presented a few cases where on SMP how we have done hair transplants and we have got amazing outcomes. So please go through our that, or you can message me. I can send the video to you also.
So, yeah, that would be great. And Dr. Sethi and Dr. Arika, a lot of people were asking me, because if you guys don't know, I was in Norwood 6, this is all transplanted hair. And unfortunately for me, I took finasteride back in 2007 and I developed side effects. So I haven't taken finasteride since 2007. And a lot of people are wondering, is there a way to predict my hair loss pattern, and will what challenges will I face because I don't take finasteride? So I guess that's a two-part question.
So yeah, so I think let Dr. Arika do a little bit of answering, but I have all your pictures here, Melvin. Let me put that on the pictures. So if you 1 minute.
So the first guide I would say is the history, the familial pattern. So what the grade of baldness was there in your father, in your maternal uncle, and your maternal grandfather. So you are likely to progress to their particular grade. And in general, we assume that everyone will progress to grade 7. So that is the assumption which we place in general for everyone. But
Okay.
what makes or breaks a transplant is the donor miniaturization. When somebody is coming to us at a very young age, in their 20s, then we might not see any donor miniaturization. But there are a subset of people. Now I don't know how much percentage of population. We have to do some big population-based study to see how many people are having this donor miniaturization. Now I would say this is the scariest thing. The donor miniaturization is the scariest thing for a hair transplant surgeon, because that can start at any age. It may start at 35, it may start at 40, or it may start at 45. Basically, so the reverse thinning and the thinning above the ears. So that is the, I would say, the worst prognostic marker of the outcome of the hair transplant. I have seen 70-year-old people with grade 7 baldness with excellent donor and no donor miniaturization at all. I think they are the ones who have reached that age without any donor miniaturization. They are the ones who are actually good candidates of transplant at young age. Now, we don't know what are those factors. There are people who, in spite of not taking finasteride, have excellent donor in their 60s, 70s also. So this is the most important thing. So whenever I see a patient of whatever age, I look at the donor, I look at the signs of reverse thinning, I look at the sign of miniaturization in between. Because the scariest thing is to find miniaturization in the so-called safe donor zone. The safe donor zone is actually not fully safe. These hair which we call DHT resistant, they are partially DHT resistant. In some people, they do have sensitivity to DHT. So for people like you who are having side effects of finasteride, I would like to take a step back, stop the finasteride, because the side effects have disappeared. I would suggest to start the micro-oral dosing of finasteride. There is no harm. I have patients who have no side effects with microdosing of finasteride, but who had side effects from the full dosing of the finasteride. Then topical finasteride is something which I think is going to stay for long. It is virtually free. I won't say 100%, but yes, much safer than the oral form. So if somebody can supplement a low dose oral with the topical finasteride in whatever form, I think that should be good for retaining the donor. So even if somebody is not taking oral finasteride, they should do something else to retain their donor. The other thing which I learned recently from one of my patients, that he has been maintaining an extremely healthy lifestyle, and he has been able to prevent aging induced involution of hair follicles. So as we know, with aging, our face becomes less hydrated, the face tends to sag, the hyaluronic acid content, the mucopolysaccharide content tends to become less, our eyes become saggy, our wrinkles start appearing. So same way as all cells of our body are aging, the hair are also likely to age. If we can maintain and reduce the aging by a very healthy lifestyle, intermittent fasting, regular fasting for 3 days, 5 days, whatever one can afford, taking whole foods, not going to the processed foods, and sleeping well. Sleeping well is also a very important component of anti-aging. So cold showers, cold baths, and all those things, regular exercise. So if somebody can do all those healthy lifestyle activities, yoga, pranayam, so I think they can reduce the aging related involution of the hair. Plus, if they can supplement something like topical finasteride, I think there's a holistic approach of retaining the hair. Once you have done a transplant, you can't forget it. You have to take so much effort, you have to put in so much effort and take care of those hair like diamonds. Only then you will be able to retain them for a very, very long period of time.
Yeah, and for me, I take topical minoxidil, and I use topical azelaic acid, and I use Nizoral, and I've looked into and also oral minoxidil, which is more powerful than the topical. And in some cases, when I talk to Dr. Bazanga, he states that in some cases the oral minoxidil improves the quality of the donor hair, because it just thickens all your hair all over. So I guess, finasteride is one component, but there are also other things that you can do for hair loss, and I'm willing to try out the topical finasteride. But yeah, for me, like the oral finasteride, I don't think, especially now that I'm married, I don't think with the side effects, I don't think I'm gonna try the oral, but maybe the topical.
Melvin, a few questions I would like to take up. There is a guy called Happy. He has asked, what about recipient dominance? He said, have you ever seen like recipient dominance of a beard hair being transplanted and they're behaving like scalp hair? Like we have enough of the experience. Like me, Dr. Arika is nodding, like shaking her head. So we have enough of experience of this beard hair on the scalp, and we have not seen any kind of recipient dominance where it has gone there and become like a kind of scalp hair. It has never happened. And however, the smartness, it is a doctor's smartness, how he's mixing them well. Like a guy like Melvin, his beard is like going to become kind of long. The way Rahul's beard was, his beard hair were very straight hair. If you see my beard hair, they will be kinky. Difficult to have. You might feel in the hands the brushy or kind of vary. But Melvin's hair, Rahul's hair, they will not be. They will be like if you see Carl's hair was like because his beard was straight and they were straight hair as well. It is not that a kinky hair will become straight hair or straight hair will become kinky. It never happen. So we have not seen any recipient dominance in our more than 10 years of experience. Another guy is saying like whether PRP is going to help my PRP, like scientifically not going to help your baldness. It might help in other kind of hair falls, but PRP is not going to stop your miniaturization of hair, which is due to the male hormone. Then a very good question by Henamias Goki. He says, have you ever, Dr. Pradeep and Dr. Arika, have you ever experienced permanent nerve damage by FV? FV is usually done by usually 0.8 or 0.9 millimeter punches that we do extraction, and of course very tiny needles that we make slit from the front. Anyway, there are pricks. There is, when we'll be making slits here and making kind of cuts on the back. So the skin surface has got like a kind of webs of nerves coming and merging. So when you prick, definitely we are kind of damaging them, and usually they heal well. And having said that, there will be maybe, like I would say, in my 10 years of experience, you have got one or two guys who have got only one small spot which is not getting the complete sensations. Maybe 1 square centimeter kind of thing, which is not getting a complete sensation. That means there could be some permanent nerve damage, which is not repairing the way it usually heals. It is not a big deal because they have got a peripheral nerve. They come and they kind of they cover it up, but still there could be some chance that some small area which is not getting permanent thing, theoretically possible. And in my 10 years of experience, I said I have got only one patient, is a very close friend of mine. She says, Pradeep, this portion I am not getting my 100% sensation back. So it is, Dr. Arika, do you have any experience of that kind of thing? Not getting complete sensation back either in recipient or donor?
So, see, theoretically, yes, it's possible, but practically, I've seen people with prolonged sensory loss. Their sensory loss may be taking sometimes 4 or 6 weeks for full recovery, but with FU, we have never seen a case of a permanent sensory loss, whether in the recipient or the donor. But the anesthesia, it takes some time to recover. There are few set of patients who complain of paresthesia, stinging sensation, or a current-like sensation in the recipient or a donor zone, because some of their nerve might have gotten irritated, but it's never permanent in my experience. But with FUT strip scar, I've seen very rarely one case, I would say, having a permanent loss of sensation near the strip, which was not too bothersome.
So
And
one
also,
Melvin, sorry, bro. There is one very good question. Like, I really wanted to answer this. First off, is asking, doctor, do you use beard hair as last resort? If scalp donor is depleted, I want to preserve scalp donor for frontal half for future loss. So I would combine beard and scalp. Okay, now, very good question. Like, this is a very strategic, futuristic approach. So let's say somebody like Melvin, if he would have come to us from the first row, where I can foresee that this chap is going to become grade 6, grade 7, I would not consume my precious scalp grafts in one, on the backside. I would kind of mix them well. I would kind of, I know that I have a finite number on my scalp, and I would like to use at least 3 to 4, maybe 4 inches of your primarily scalp, and mid scalp would be scalp and beard, and I keep on mixing scalp and beard and crown. So that is my kind of my planning. Accordingly, if I can see that this guy is going to like he's balding more, the crown is visible now, then I'll mix crown and beard. Then I'll keep my kind of my reserve for the frontal kind of thing. So it is a very strategic planning. It is not that just because I know how to extract and plant, I'll keep on planting. So managing the donor, because that is finite for one lifetime. And the gateway to the face is the frontal area and the temple and all. So I will keep more of my scalp pepper here, and of course I will manage in between the scalp and beard. And again with kind of the skills that we have, we can extract almost like the great number of grafts, enough number of grafts from the scalp, so that we can do well without damaging the donor or making it look bad. And the second result for us is beard, definitely, and we use it very smartly. I learned from Dr. Arika, like when I think some in 2013-14, she started using the side lock, and she's I learned that from her. She says side locks are they have the characteristic of the scalp hair, so we have a lot of reserve there, so we can use them as and those people who have people like Melvin who have got a grade 6, grade 7 baldness, inversely due to the male hormone effect, they have got a great beard. So they usually have great side locks and all, and if you see Carl's video and of course Rahul's video where we have gone up like 11,500 in one patient, we have done 16,500. So we have used a lot of we have mastered the art and science of extracting the beard, and still somebody will have the beard also, and giving a full coverage. That is the ultimate desire of any patient who wants to go for a hair transplant. So it is again strategically planning and executing and making somebody happy for a very long period of time.
And that leads me into my question, which is, how many grafts do you think you guys would be able to extract from my beard end? I wanted to kind of get, if you have the picture, I kind of outlined where, you know, where I usually shave. Like I shave that entire area. So that's an area that you guys can really just, you know, I don't mind, you know, exhausting that area because I shave it anyways. And like Dr. Sethi mentioned, I happen to have a pretty straight beard, like it's not kinky. I grew it out, you guys saw, I grew it out maybe like last winter, and I had it probably down to here, and I would comb it with a regular comb. Didn't have to use a brush, so I know that it's something that would, you know, match my hair pretty easily. I'll still be able to comb it. So that's also something that as someone as a patient, you should be very cognizant of. If you have straight hair like me, but your beard is very kinky and very, you know, bushy and it just doesn't match, it's not going to be as good as if you had straight hair and your hair is straight. But if you have curly hair, really curly bushy hair, and your beard is bushy, then, you know, that matching is favorable. So always be aware of that.
So I would like to answer to this question of yours, Melvin. So, so that picture of yours that you wanted that, you know, the hair can be taken from that lower part of the neck. So now, with all our experience, I can tell you that the lowest part of the neck, in most of the people, they are not the best of the hair. They, you know, the caliber, not the best. That means if you extract them and plant them, they might not show up. They might ditch you. So the best quality of hair is the over the chin, and if you go to sides over the mandible, you know, they're the best quality of hair, and of course the side locks. They're the best quality of hair. Yeah, we have almost every day we dive into the beard. Every day we know how it behaves, both Caucasian, Asian, Indian. So 50%, the rule of 50% applies here as well. If you take out 50% of hair alternately from the beard, and after 1 week, you will see that you have got same kind of volume of beard. That means, you know, it is not that we should only restrict to this kind of thing. You should know the quality of the skin. Like let's say like our kind of skin. I have got a lovely skin. Dr. Arika has got a little bit of fairer skin. You have got much fairer skin out of three of us. So the scars and that happens here, like on the face, is kind of imperceptible on skin like yours. So if you go up to here, so then also after 1 week, kind of you got a very sharp punch, tiny punch, and you have got expertise to have the right kind of traction at the time of, you know, pricking the skin. Then, you know, of course, when you are extracting the grafts, you are not mutilating it. Everything is correct. Then it is very difficult to make out from where you have taken. Even I can't make out from where I have taken the hair from a skin like yours or Rahul's. Rahul has got fair skin like yours. So of course, Carl, his beard picture must have seen. So you should diffusely use the beard hair. Let's say I need to extract close to 2000 grams from the beard like yours. I should not be restricting only to the lower part only. I should be able. And of course, I need the best quality of beard hair. So I should do them all over. Take them diffusely and plan it like evenly all out. And then after 1 week or 2 weeks, you can grow your beard again. And I can guarantee you, after 1 month, you will feel like, my God, I've got same amount of beard the way it was before my extraction. And we have got plenty, as I said, almost every day we dive into the beard. All kind of skin color, all kind of hair quality, kinky, non-kinky, straight like yours. So, but having said that, there will be some people whose beard will be great here also. Carl's beard was great, like his beard had got double, triple hair on here, in the neck. Like it was very kind of, you know, extended here. So that case is different, but most of the cases, the lower part of the beard are not the best of the hair. So we should use the best of the hair, because ultimately we want them to grow here and kind of contribute to the volume. So in your case, we are not going to restrict only to the part that you have demarcated. We will kind of, you know, will try to extract hair, the best of the hair from all over. And with all our skill set experience, we can guarantee you that the kind of look that you have now, after the 2000 grafts have been extracted, maybe you can go for more also, but I think you don't need more than 2500 grafts on the crown. So my plan would be, in your case, close to 2000 grafts from here and around 500 to 600 from your backside. There are some areas where from here you have not taken yet. So I'll be taking, kind of, we'll be going here and there where like the grafts are there, and we will take 500-600 from here, 2000 odd from your beard, and 2200, 2500 we can kill your crown.
Yeah.
Of course.
Yeah. And so I learned something. I learned something right now because as a patient, I was thinking, just take all this hair because I don't use it anyways. Just deplete it. And a lot of patients, a lot of times, they think that way. I don't really, I don't care about my side hairs. I shave it, so just take it all. But it's a better approach to take a diffuse. To take a little bit of hair everywhere, because when you take a little bit of hair everywhere, when it grows back, you can't see it because it's very it's like a mosaic pattern. It's over a broad area instead of concentrating on one area, because when you concentrate on one area, you will see, no matter what, you will see that there was hair taken from there, because you'll notice it because it's all concentrated in one area. So it's a lot better to do it spread out over the entire zone, and when it grows back, you won't be able to notice. Thankfully, I've got a pretty thick beard. I think I'm pretty close to Carl in terms of like beard thickness. But I guess we'll see once you guys see me in person. You guys will obviously examine the beard, right, and all of that, as well as my donor.
Yeah, true. So
but Melvin, I would like to differ on that area where about taking it from the cheeks. Okay, there are issues of people developing erythema. People are more like these days with the people have a habit of sporting a very good dense beard over here. So I feel extracting from and restricting from this zone, the submandibular and the submental zone, this anyway is the shadow area of the face. I think this is a better approach, but yes, if the surgery requires more, then there is no harm in coming over the face. But doing the face can be a bit of risk. And again, as we go towards the upper border of the beard in this zone, again these hair they don't do well if we do use them for the transplant. Somehow this is the most fertile zone, I would say, when it comes to seeing the beard results. So I tend to restrict myself below the jawline. And yes, it does look less dense and patchy, but because it's a shadow area, it doesn't bother much to most of the patients.
Yeah. So that, like, I was just kind of telling the last part of my point is, if the number is less, let's say around 1000 odd grafts, so there is no need to go up. But if the number is more than that, and ultimately somebody wants to enjoy hair on the top, and you have to kind of take a little bit of balance approach that ultimately somebody needs to be happy here, and we know that the erythema and everything that goes away, like you have to prepare somebody that erythema means pinkishness that stays for a while, and of course the hairline of the upper part of the hairline of beard, they are not great. So also the lower part of the hairline of beard also they are not great. And as Dr. Arika said, mostly we do manage from here, but if somebody requirement, like you have got, whether it is Carl or whether it is Rahul, or maybe potentially in your case, we will tell you that of course you have to protect yourself from sunlight for maybe for 1 month, so that they are not. In some people it heals like amazingly. Within 5 days you cannot make out from whoever taken. Both in dark skin, brown skin, and kind of fair skin. In some people the erythema lasts for a little bit long time, but ultimately it goes away. If the doctor is confident and the patient has been counseled well, and he knows what is the ultimate outcome, and he knows that you have to go through this kind of the phase of pinkishness or pigmentation, but after 1 month, 1.5 months, everything will settle here, and the ultimate goal that to have dense hair on the top is achieved. So again, depends on the number of grafts required, and and how the patient has been counseled. But a small number we would like to restrict here. If the number goes up, then definitely we need to take it evenly. And we definitely don't go to these hair are not great, and we don't use them. And that's it. So it is the depends on how many grafts that we all need. But beard is something, a great area where gradually, of course, we have been using beards in 2010, 2011. Initially, we were very enthusiastic. Then gradually mastered the art of extracting maximum from the back. We don't jump to the beard so fast. But initially, when we were like let's say till 2018, 19, we used to jump to beard. Nowadays, we are jumping to beard little bit kind of. The threshold is more. We don't go that fast to beard. But if there is a need, then we go there. And we have got the skill set to kind of justify the need also.
Yeah,
So one
yeah. I
thing we
mean,
should
I think.
always sorry. One thing we should always tell when we are doing the beard is the texture mismatch will be there, no doubt. Whatever we do, we have to do some using some gel, hair gel or hair wax to make those hair not stand out unesthetically. Number one. Number two, the density. The density in beard hair is definitely lesser than the scalp hair, as we know the anagen phase is the telogen phase is longer in the beard hair. So at one point of time, if we have planted 1000 beard, we'll be able to see only 500 hair because only 50% of the hair are in the anagen phase. Whereas in scalp, if we have been planted 1000, we'll be able to see 800 hair at one point of time because the anagen growth rate is faster in the scalp and telogen proportion is less. So this is also very important. When we have exclusive beard in one zone, there will be a lot of see-through. There will be some texture mismatch, and you'll have to use hair gel or hair wax to blend those hair with the scalp hair.
Yeah, that's an important thing you're talking about. So the anagen growth phase is shorter for the beard. So meaning its life cycle is a shorter life cycle. It's about half, right? The hair is a couple years. I think the beard is maybe like a year and a half or something. And then the resting phase for the beard hair is actually longer. So it's in a resting phase longer than your actual scalp hair. So you may go through phases, and this is something that I'm obviously preparing for. I may go through phases where the crown looks a little thinner than it did maybe last month, and maybe I could be thinking, oh no, is it just, am I losing my hair in the crown? But no, it's just that the hairs are going through resting phases. So I'll go through these cycles. So that's a very important thing to be cognizant of if you're going to be getting a lot of beard hair in your crown. So that's a good point. The texture thing also is a good point. I think my texture will be similar. Obviously, it's not going to be exactly the same, but it'll be pretty close because it's pretty straight. I'll still be able to comb it. And I use gel and I use wax anyway, so that wouldn't be a big concern of mine. One question that I did want to ask you guys, and I think it's an important question to ask any clinic that somebody's going to, is what do you guys do when a patient isn't happy? Maybe their expectations weren't met, or the results didn't come out as expected, which when you're doing surgery, that's just inevitable. It's a part of performing surgery that complications can occur. And that's with any clinic in the world.
Can I answer that?
Yeah.
And we have only 3 minutes left. After that, it will close. It is so. Once we take up, that is the philosophy of Eugenix. That's what we are standing on, me and Dr. Arika. That anybody who we have taken up as a patient, we have voluntarily taken him. That means with all our intelligence, skills, and everything, we have taken him. If he is in the first go, we are very sure that he is not going to get result, or the expectations are kind of what we can deliver, what he is expecting or matching, we will not take him up. There is, commerce has never compelled us to do a procedure. It is the science followed by ethics, which has kind of translated into our practice. So if somebody we have taken up, and if that person is for whatever reason, and it is not that it has never happened to us, it has happened very rarely, maybe once in a year, but happened that the person is not happy, and we are also not happy at the same time, because we know that for which he has come, he has not achieved. Then it is our moral responsibility. That any patient that we take up is our, he becomes our family member, and if he is not our family member, I will not take him up. If there's not that kind of connection, then usually we that doesn't happen in Eugenix. And if he's not happy for whatever reason, we get the person back and we fix it, whatever it costs, whatever it happens. We have done that. Like, as I said, it is not. It has happened to us. Like maybe 5-6 odd patients that Dr. Arika will also remember. We have called them back and fixed that without any cost. And because, as I said, his head is our head. His smile is our smile. His happiness is our happiness, and that's what has motivated us. And if that would not happen, then probably we will not continue as doctors. Like, that's the only gratification that we get when somebody, that all our patients, they become my friends, and they are our family members, and they only refer their friends. It is not that the reference kind of greed that drives us, but it is their happiness, and earning them as friends and making them forever. They have come to us for happiness, and if you have not delivered that, it is our moral responsibility to fix that and make them happy at whatever cost. And usually, we have got very, very less patients who have not been kind of the way they expect to not happen. We have fixed them, and we are determined to fix them. Maybe some 200, 300, 400, 500 grafts, whatever has happened, we have done that. Sometimes patient comes up a little bit off, and sometimes we have done something, but ultimately the bottom line to this is making him happy. So that's what
the evaluation has to be very objective when it comes to determining the success or a failure, or a partial success or a partial failure for a surgery. We need to have a comparison of a pre-surgery, immediate post-op surgery pictures and the current pictures, 9 months or 10 months or 12 months post-op. So once we compare all the 3 pictures in the same angles, then we'll know that where the lacuna has been left, which particular area is showing an island of poor growth, and then we need to fix up that angle, that particular area which is concerning to the patient, by doing a free top-up surgery, I would say. And that is what we have been doing. And the chances of complete failure have not been there. There have been some areas of concern where the patient has been dissatisfied with the density, and that has been more so in exclusively beard areas. So that is how we learned that we stopped implanting a lot of extra beard and relying more on the scalp hair, strategically placing them, telling the patient the density won't be that great. So if we do the pre-op counseling correctly, then usually the expectations are correctly set.
I think that's a perfect way to put it. Counseling the patient beforehand, letting them know what to expect out of the surgery, so that they know, that their expectations can be met. Right? Not every patient has realistic expectations, so it's not going to always. You're not going to always be able to meet their expectations, because it just may not be surgically possible. So I think that's super important. So that's one of the reasons why I chose you guys. Is, for one, I know how great of people you guys are. I know how close you are with patients. I know Dr. Sethi, he's close friends to almost all of his patients. I mean, all the time he's talking to his patients, and they share pictures with him, and invite him to their wedding and all these things. He's got that warm personality, and I know I'm in, like he said, I feel like already family. Once I'm gonna have surgery, I feel welcomed. I feel great. I'm very excited. I know it's gonna be, you guys are gonna take care of me. I have no doubts about that. And your guys' skill. I know, obviously, that my crown is never going to look like it did when I was a teenager. Like, I don't have any balding, but an improvement is what you should be seeking with surgery, not perfection. I think that's a big thing that people should put in their heads. Look for improvements, not perfection, because perfection, you don't want to be chasing perfection with surgery. It's just not. It's not possible, and it's not going to happen. You should be looking to get a good, visual improvement. So, and I'm confident that I will get that with you guys, and I've seen your guys' work and your examples, and your track record speaks for itself.
I think it is going to close. It is Dr. Arika. I think we're going to go close.
Yeah. It's been past an hour. Thank you guys so much. It's one last question for Michael. He said, "Can oral minoxidil increase the anagen phase of the beard, the growth phase of the beard?"
We don't have much experience of oral minoxidil, and I like Dr. Arika. Do you have any kind of answer to that?
No. I don't prefer to prescribe oral minoxidil much because it does. Its effect is similar to that of the topical one, so I have not ventured into that particular drug, and I don't know whether it prolongs the anagen phase of the beard. I'll have to check that. But still, it's not one of the things which I'm going to prescribe in near future. I don't have the confidence on this particular drug.
Yeah, it's something that Dr. Bazanga prescribes a lot, and he swears by oral minoxidil and topical finasteride. That's his favorite protocol. I could say the oral minoxidil, I feel like it does. Feels like my beard grows like that. Like it's just, I mean, I shaved this thing yesterday, and it'll be like this. You know, it's just, it grows in quick. But yeah, I don't know if it does.
But has it started growing quickly after you started oral minoxidil, or was it growing quickly?
Yeah, after. It was, I felt like it grew quicker, and my body hair too. I feel like my body hair grows quicker. Everything I feel like just grows
so
quicker.
It means oral minoxidil is causing generalized hypertrichosis. It is causing hair growth in all parts of the body, maybe.
Yeah, I believe, yeah, for sure. Which may not be desirable for some, but I'm already a very hairy person, so it doesn't really matter.
Melvin, what dose you are taking oral minoxidil? 2.5 milligram daily?
1 milligram.
Okay.
Yeah.
So yeah, I know Dr. Bisaga, he does prescribe, he's very kind of oral minoxidil person.
Yeah.
So I believe it is miniaturization to the male hormone. So minoxidil has nothing to do with the miniaturization. It has a generalized kind of thing. But miniaturization, that is the culprit, the male hormone, DHT. You have to tackle that either by oral finasteride or topical finasteride. But definitely we are keeping our eyes and ears open for oral minoxidil. But kind of scientifically, theoretically, it has kind of no direct effect with the miniaturization, the baldness process. Thank you so much.
So we're at an hour now. There were so many good questions. I think we tackled some really good things, especially about the beard hair, about how it's going to look, about how many grafts you can take. So just to conclude, because I'm going to put this on YouTube and everything, how many grafts do you guys calculate you'll get? I mean, approximately when I get surgery, like how many beard grafts do you think you guys can get?
According to my thing, easily we can pull out 2,000, 2,500 grafts from a beard evenly, and depending on the requirement, as I said, I will balance around 500-600 from my back, and rest close to 2,000 odd from your beard. So I guess I have seen the pictures. I'm sure Dr. Arika has also seen the pictures. Around 2,000, 2,200 to 2,500 required for your crown digitating into the planted area also. And, so little bit I need to do your touch up of your hairline and little bit temple also. So I think around 2,000 odd I will take from your beard.
Yes, I need.
Dr. Arika. Hello, Amen. This is Amen.
Hey, Armin.
Hello, bro. Hello, bro.
So I'm also going to be doing the temple points. As you guys can see, it's a little bit receded back. So that's another thing.
The temple point. Do you feel? I'm sure you will agree that the temple grid has been induced in you by Armin from.
Yes, absolutely. Armin he's the little devil on my shoulder, saying, "Do the temple points, do it."
Even what Carl is saying, Carl and Armin both are there, Melvin. I told you he would get temples.
And not everybody can do temples. And just before we could get cut off, not everybody can. Temples is one of the most hardest things to get right by a clinic. And if you're going to a clinic that you don't see temple points, them doing temple points, don't do it. Do not, because this is you need to pick the perfect hair, get the perfect angle for it to look natural. And you know, Dr. Sethi, Dr. Arika, they're masters at temple points. I mean, Ajit has his temple points look absolutely incredible. I mean, one of the best temple points I've ever seen transplanted ever. It looks incredible. So I'm hoping that when I go there, I will be the new Ajit. You know, so let them know that. I'm hoping when I go there, I will be the new Ajit and get the same temple points.
So I'll tell you something, Melvin, Armen, and Carl both are listening. We have discussed a lot about temple points, and I think if anybody in the world who has, as a patient, not as a doctor, but as a patient, he has got like the knowledge, the detailing of the knowledge of temples. I think it is Amen. You know, he has got all the knowledge of temples, how it should be, this, that, and all. And most of the people that don't demand for temples, it is me, like primarily, who I tell that if you do the temples, you can look yourself, Melvin, that your forehead is wide because the hairlessness is wider here. If you can bring little bit kind of anteriorly, then the youthfulness will come back. Yesterday somebody had come, he has got temples done from somewhere else. You can see that bushy hair, the looking so, and the people who did a temple, they knew how to extract and plant, but they never knew which quality of hair, you know, how they should be placed. And how far you should go, how to do under correction. A lot of things are there. Temple is difficult, but if you do it well, the gratification that you get, the youthfulness that you get is like, you know, unimaginable. So you're right, temple is very, very difficult. And I tell young doctors that don't attempt temple as long, you know, maybe for initial 10,000, 1,000 of your patients, don't do it. Master it, imagine it. If you're not imaginative, if you're not a kind of, you know, artist, then don't touch it. You would grow hair, but they look bad hair. And the temples are not on the scalp, they are on our face. They will stand
Absolutely.
up. They look very, very perfect.
Also, I want to just, for anyone who, like me, who is an over 6, you know, usually your temples go back. And if you have a thick hairline, let's say you get everything good thick, but your hairline, your temples are straight, it will sort of look like you have a wig. And that's the truth, because you never see thick hair and this receded back. It does not look natural. So that's something you also have to be cognizant of, is as this starts to recede more and you have hair here, you don't want to have that sort of like artificial wig look, which it will look like. You know, like back in the days, people would wear wigs and, you know, they couldn't do their temple points. So temple points is very important for naturalness in the future, which hopefully once I go and visit you guys, that will be no longer a concern of mine.
Armen is saying that Melvin is going for your hairline too. Answer is yes, yes. once Melvin will be the kind of lying on the table, so definitely we're going to touch his hairline. Actually, hairline is like I made a few videos for hairline. I'm extremely passionate for hairline. Like if one hair does not grow the way I have imagined, I get restlessness. Like, you know, after, you know, you don't have time to rectify. After 9 months, you will see the hairline kind of thing. So initial 6-7 years of my career was like, when I was madly obsessive about right kind of hairline, positioning, right kind of madness with the right hair, baby hair, so that looks very soft and nobody can make out it transplanted. So yeah, so life has been spent there. There is one guy who said the transplant or accidental scar. Yes, we have done a lot on the scar. Of course, you will not have the density, but yes, so we know the trick how to do on scar. So nice to see and you know, Carl will be there, and we had a great time last week when we were there with us in India, and we had like, you know, almost every day I'm talking to Armen, and he's such a nice soul. Like, you know, he has got warmth, he has got intelligence, he has got you know, he has got everything correct, 100 out of 100. I feel like I'm blessed to touch his skin, and I'm blessed to choose. Of course, his primary doctor was Dr. Arika, but later on I came just touched him. But if I would not have met him, then it would have been a huge loss for me. And so with Carl, and it was huge. Of course, as a patient, Carl has got a transformation, but as a you know, as a friend, as a brother, you know, as I know, like I treat all my patients as my own, and that's what Eugenix is. And I have become a very big family of more than 10,000 people. So.
And you know, and that's part of the thing that and for people who don't know, like I talk to Dr. Sethi regularly after we met, I don't know, was it almost 2 years ago here in LA? I talked to him on WhatsApp, and I actually talked to Armin and Carl, and yeah, I mean, I just feel like so at ease, and knowing that you genuinely care, you know, like as a friend. So that's sort of just something that you don't get a lot in a lot of other surgeons or clinics. Like, you genuinely care, and I know I'm in good hands. You're really going to take care of me, and that's something special that you have. So that's something special of Eugenix, and I think that that's something that anyone who's looking at to get a clinic, something you may want to look into, because it's definitely important, and you know you're going to be in good hands. So I'm super excited. Thank you guys so much for this opportunity to, you know, pick your brain and ask these questions, and, you know, do this live consultation for the world to see, so they can see what questions they should ask, you know, any clinic, whoever they're interested in going to. I look forward to filming the whole thing documentary style. We're going to get every aspect of the surgery. You know, any question, any doubts that someone's having, you know, I will be there, you know, giving my firsthand experience, and you guys will be there, you know, talking technically. So I hope you guys stay tuned. It's going to be very exciting. And so, yeah, I just want to thank you guys.
Thank you, Amen. So
Thank you, Melvin. Thank you so much.
Thank you. All right, Armin, take it easy. Take it easy, Carl. Bye-bye.
Bye. Thank you so much. All the people who have attended, asked questions, and the team Eugenix who helped in arranging thing, and hopefully we'll do it with Carl and Amen soon, maybe next week.